I am a neurologist. My name is Nihal. My last name is Işık. Okay. Mostly I specify on multiple sclerosis disease. Multiple sclerosis is an interesting disease. It's an immune system disease, and mostly it affects the young people. Mostly multiple sclerosis patients are between 20 and 40 years old. It's a kind of misaffection of the immune system, misplan of the immune system. So the immune system works a little bit wrong, and in brain, multiple sclerosis patients have some lesions that occurs in the myelin sheath of neurons. When it happens in brain, patients have some symptoms, like if it occurs in optic nerve, patient comes to us with that blurred vision. Or it happens in somewhere else. They feel like numbness or feel muscle weakness, or they can't walk. Lots of symptoms they have, and in young age. So it's an important disease, and sometimes a little numbness in your finger or in your hand, it is important. In a wide range, like the numbness, as I said before, small parts of the body you can feel, or the patient feels numbness. And the important thing, these symptoms must occur more than 24 hours. If a patient has something like 15 minutes or 10 minutes, we don't think about multiple sclerosis. The duration is important, but that slight symptoms sometimes mean that the patient has multiple sclerosis, so they are important. We don't have a radical treatment. So we don't have a drug that if a multiple sclerosis patient has the drug and the disease is gone. No. We have some symptomatic treatments for the symptoms, and we have cortisone treatment for attacks. If a patient has some symptoms, we sometimes give 5 or 7 days high doses cortisone and just suppress the symptoms. But for a long time we have some immune modifying drugs, that these drugs are just function on immune system. So with these kind of drugs, the patients have less attacks, less symptoms. And during the life, the immune modifying drugs, we call the drugs that they affect the immune system. They suppress the attacks. Patients have less attacks. And then they have less symptoms and less weakness during their life. So they work better, they live better. And now, last 5 years, we had lots of drugs in this type of drugs. The first drugs, actually, they were just injections, but now the new drugs, patients can use them orally. If the patient has some psychological problems with multiple sclerosis, of course, especially the sport activities like Pilates or other type of yoga, it helps a lot. But you mean the alternative therapies of herbs or other things? We don't know, and we don't have any
results about that.
Yes, you're right. Well, actually, in Turkey, we have a really active multiple sclerosis groups. They work really active. Sometimes patients, sometimes doctors like us. Yeah, face to face. So people mostly know about drugs, mostly. And now the programs on TV and after the MRI especially, patients know lots of about disease. Surgery doesn't help in multiple sclerosis patients, but sometimes like toxins like botulinum toxin, if a patient has really stiff arm or stiff leg, we use that kind of medicine. But surgery, no, they don't help a lot in multiple sclerosis patients.